Hello everyone, I'm Jessie. In this video, we will look at the joints in the angle and foot complex. I will start with the angle joint. Angle joint is also known as talocrural joint. Articulation. Articulation between the distal end of the tibia and fibula and body of talus. Type. It is the hinge variety of synovial joint. Proximal articular surface. Mortise. Medial malleolus of the concave surface of tibia to the lateral malleolus of the fibula works together, or it seemed completely together as a one rigid structure. That is known as mortise of angle joint. Angle joint is an adjustable mortise or mobile mortise, but the mobility is restrictable. It can expand, but it can't expand beyond the limits. Proximal tibiofibular joint. Articulation. Articulation between the posterolateral aspect of the tibia with the head of the fibula. Articular surface is flat, but in some studies shows that, and in some humans the articular surface of the tibia is bit convex, whereas articular surface of the fibula is concave. Type. Plain type of joint. Ligaments. Anterior superior tibiofibular ligament, posterior superior tibiofibular ligament, and interosseous ligament. Distal tibiofibular joint. Articulation. Articulation between the distal end of the tibia and distal end of the fibula. Type. Fibrous joint. This joint has no joint capsule. Ligaments. Interosseous ligament, anterior inferior tibiofibular ligament, posterior inferior tibiofibular ligament. Importance of proximal and distal tibiofibular joint. The stability to the angle joint is in fact related to the distal tibiofibular joint, which is related to the proximal tibiofibular joint, because when the proximal is weak, when the interosseous membrane is weak, when the ligaments are weak, it will alternately affect the distal tibiofibular joint. This is the importance of proximal and distal tibiofibular joint in the angle joint. Fibula can provide some sort of movement, and this movement will help the mortise to move each other. Distal articular surface. Articulation. The body of the talus has an articular surface known as trochlear surface. The body of talus has a medial and lateral facet, which is articulate with the medial and lateral malleolus. Peculiarity. Talus is not having any muscle attachments. Ligaments. Anterior and inferior tibiofibular ligament, interosseous ligament, medial collateral ligament, and lateral collateral ligament. Medial collateral ligament. This ligament starts from the medial malleoli and it runs anterior and posterior, which is continuous with the bones that are cuboid, calcaneum, and navicular. It is a strong ligament and also known as deltoid ligament. It is fan-shaped ligament, that is why it is called deltoid ligament. Lateral collateral ligament. Lateral collateral ligament has three ligaments. There are anterior tibiofibular ligament, posterior tibiofibular ligament, and calcaneofibular ligament. The anterior tibiofibular ligament is weak. Both the anterior and posterior tibiofibular ligaments are horizontal ligaments. Calcaneofibular ligament is vertical in orientation. In this video, we saw angle joint, distal tibiofibular joint, and proximal tibiofibular joint. The next video, we will see subtalar joint. Thank you.